First guest, Sacramento Mayor Darrell Steinberg. Mr. Mayor, welcome back. Glad that you've been able to move your schedule around to appear with us weekly. We did mention this morning $89 million that the city is getting in aid. What are you planning to do with that?
Good morning, Walt. Well, we have our first public meeting on an expenditure plan. I put out a letter last week in which I suggested we break it into 4 pots, all around economic recovery. $21 million, $20 million, to assist small businesses. $20 million for workforce retraining and workforce development. $20 million for housing and homelessness, and $20 million for tourism, arts, and the creative economy. These are a combination, if you will, a balance between emergency aid, which is so desperately needed that the $89 million would not go far enough to help every small business, every individual. But we need to help as many as we can. Balance that with investing in some things that are going to create some sustainability as people get back to work. There are a lot of folks, for example, Walt, working in the hospitality area who may need to rethink what they want to do or what they can do in terms of a job or a career pathway. And so workforce training is a key component of what we want to do.
Next question coming in for you, Mr. Mayor. We've started moving into phase 2. What's your take on how quickly the governor is reopening the state? Do you feel obligated that would there be anything he's doing that you would say, you know what, I'm not quite on board with this?
No, I mean, I think he is led in an exemplary manner in the toughest situation imaginable. You know, because of the lack of testing in terms of scale, where you could really aggregate people who have tested positive, those who had developed antibodies, those in the middle, where you could go back in a bigger way safely. Unfortunately, what we face here is a situation where everything we do in terms of returning to work, returning to business, has to be done in sort of a controlled way. And so what the governor really did last week, Walt, is that he said, let's allow some of the smaller counties to reopen and open faster. And then let's look over the next 7 to 10 days whether or not they see a spike. If they don't see a spike, well, then I think the signal will be for larger urban counties like Sacramento to be able to take the next steps. But it necessarily has to be done in a deliberate way, because as we've talked many times, if we go too far too fast and there is a big spike in illnesses and deaths, we will then go back and it'll be even harder, obviously on the people who get sick, but harder on the economy.
So the next question, some counties, and you did allude to this, Sutter and Yolo have tried opening up a little bit faster, the governor, than he would like. So that's actually Sutter and Yuba counties, not Yolo counties. Are you worried about that? And then you also mentioned, you know, some of the outer counties opening now and watching for a spike. How would you know for sure about a spike if there isn't really testing going on?
Well, you know, it's a little bit of Russian roulette here, and I was not happy with those counties that defied the governor's order. How would you know if there's a spike? You would see increased numbers of people going to the hospital and increasing numbers of people that die. I say look at the hospitalization rate,
okay,
because that will tell us a lot about whether or not we are opening too fast. Look, we have to reopen. We all know it. The status quo is not attainable for the long term. And as Governor Cuomo said, and I actually said it before Governor Cuomo, so you know, he owes me a thank you here, okay, which is, it's not if, it's not even when, it's how we choose to reopen. We've got to do it in the right way.
Next question for you. Governor Newsom's May budget revision is due by Thursday. What are your biggest concerns with what he's going to reveal financially?
Well, if you remember, Walt, I was the Senate leader during the Great Recession, and I presided over and helped with my colleagues to solve a $42 billion deficit over 4 years. This deficit is projected to be about $54 billion, larger than what we faced. And so I'm very concerned. I know that the legislature and the governor are up to it. And my advice to them is that throw purity, if you will, out the window. Do not cut everything just to balance the budget. If you have to use some creative financing, if you have to borrow to get through this to avoid even deeper cuts, then do that, because this may take several years to get out of, and you want to do it in a way that does the least amount of harm while moving towards a balanced budget. And finally, everything needs to be focused on Washington, D.C., on the president and on Congress, because a fourth stimulus that provides direct aid to states and more to cities is really the only way to avoid a lot of pain.
Now, the next thing we want to talk, you had an op-ed piece in the Los Angeles Times yesterday. You talked about mental health care. Part of the article involves something your own grandmother used to talk about regarding seniors. So could you discuss that?
Sure. I mean, the coronavirus is the pandemic. I worry that the next epidemic is going to be mental health, because obviously the impacts on people's lives and the rates of depression, for example, some suicide lines, one major suicide line in Los Angeles saw an increase of 21 calls in February to 1,800 in March. And it's no secret why. People are under an immense amount of stress. And so we not only need to improve the systems, but as I wrote, I think we need to democratize the mental health provider movement. We can all be providers with a little bit of training, what they call mental health first aid. We can all be trained to help one another during this time, because there aren't enough psychiatrists, not enough psychologists. There are not enough professionals to meet the immense demand. So we've got to figure out ways that lay people can become supports for shut-in seniors, for youth, for teens, for people who are really feeling it. And I think there's a great opportunity here to make mental health one of the next great priorities. It's going to be.
All right. Mayor Steinberg, we thank you for your time. We do appreciate that. Visit again soon, hopefully next week.
This interview involves commercial content. The products and services featured appear as paid advertising.